from Indonesia, so I'm coming from the Southeast Asia. So probably you have been listening from the Africa side. So let me bring the issue from the Asian side, the southern part of Asia. From the Asian part, we have global health true leaders. Why we named this idea was started with the support from IDRC when they have the Eco-Health Field Building Leadership Initiative. Some of you probably questioning about what is the relationship between Eco-Health and One Health. Some of you probably have some experience involved in IDRC supported program on Eco-Health. I've been involved in Eco-Health, and now I'm involved in One Health, and sometimes I'm becoming confused. What's the difference between Eco-Health and One Health? So everybody trying to talk about health, but I sense that there is a global aspect on those two things. So that's why I promote the issue of global health, because I've been working in the international arena, and I think there are many differences in the world, and there are many conflicts potential in the world. If we cannot work together, we cannot solve the problems. So that's why I'd like to encourage you all to work together in the area of global health. Because as mentioned by Prof. Kasumba, that what is the One Health corporate destiny? What is our destiny? I'd like to translate my destiny, and hopefully also yours, is that we have to work together across professions in the world. Not only in Africa, not only in Uganda, not only in Indonesia. So that's why this program is promoted because I'm really concerned about the issue of zoonotic disease. And I see one of the challenging problems of everyone in the world is HIV/AIDS. Up to now, I believe that this HIV/AIDS is originally a zoonotic disease. But now we have many others, and hopefully we just only have one with HIV/AIDS, not with the others. So this is one of the examples when we are talking about Ebola, for example, in Western Africa. It has been a long time that the problem over there. Many people in the world would like to help, but sometimes they don't know how to do it. Many volunteers came to the countries over there, and they try to help. But for you in this room, that if you are a veterinarian, probably you are not familiar to work with medical doctors. Like for me, I'm a veterinarian. And also for you who are medical doctors, you are not probably familiar with working with the veterinarians or social scientists. So that's why this idea is to bring about working across professions at all levels, including international level, if we have problems like Ebola in Western Africa. So that's why this program is started now already 5 series in Southeast Asia. It started in Indonesia. This program jointly funded by the IDRC and USAID. I finally convinced those two funding agencies to work together. At the beginning, IDRC said, this is future leader. USAID said, no, this is tomorrow's leader. So finally I said, this is global health, true leaders. Because we are promoting true leaders, not only a leader who have the capacity to lead, but when they go to the field, sometimes they don't know, to work together. Not only across professions, across culture, across language barriers. We have problems, many problems in the world, but if we cannot solve that, if we cannot work together, so I think we are in trouble. So starting in Indonesia, now we have 2 series implemented there, but it's not only for Indonesians. This is an international program, and it's participated by several countries in the region, not only in Southeast Asia, but including China. And then the second batch we implemented in Thailand last year. So there are about 25 people in the other countries, but in Indonesia there are almost 100 people participants. And then in Vietnam, there are also 25 people participated. and also participants from other countries joined in this activity, including in Thailand, and then also in China. The China place is rather exclusive, but it has potential because this is a big country. So it has been implemented in 4 countries, but there are 10 countries represented. So there has not been any participants from Africa, but this is potential to be implemented in Africa and also globally. So that's why we need to promote this to people to work together across continent. It's good that OSHA invited Sihun so that we can share the materials and what we have been implemented. So the materials is about the leadership, the global perspective, working multi-sectoral and across professions, and culture. Culture is a very important one because when we deal with the zoonotic disease, sometimes we have to live with the animals, and it's in the academic it's easy to say that you can slaughter the animals, but sometimes culturally it's not acceptable. So that's why with the case studies and also role play in the room, so we work together. So you can see that the training involved not only medical students but also veterinary students, public health, and other fields work together. So this is a good experience for the students before they go to the field, and finally they graduate from the universities. So we have several modules, so 6 modules in global health and becoming true leaders. Especially we taught how to, with the culture, beliefs, values, and ethics and morality, to be the leader at the global level as well as at the local level. They have to understand about it, and also partnership and collaborations. Most of these are soft skills, which is very important. The hard skills have been taught in the universities. So these are the field activities. They work together. So hopefully when they graduate, they can also work together at the international level also. And this is the leadership training. They have to have the spirit. They have to be brave, but they have to be careful. So that's why the combinations of technical skills, soft skills, and also training, exercise, physical training, to make them, to be, true leaders. These are the participants. It's almost 200 people involved in almost 2 years. So we are planning to have more activities, and this is part of the Sihun activities annually, and hopefully that there will be more participants.